Hello, UCCS alumni and friends. My name is Joanna Bean. I'm Director of Alumni Relations and Annual Giving here at UCCS. And very happy to have all of you here today. We have a special guest as part of our 5 Things You Need to Know series, which brings UCCS faculty and staff to you to talk about their research and work and the exciting things they're working on. Our other sessions are housed on our alumni website, and more are planned in the coming weeks, so please watch your email. With no further ado, I want to get right to introducing you to Dr. Chip Benight. He is a professor of psychology at UCCS and the founder and director of the Trauma, Health, and Hazard Center. His research area is human adaptation from trauma. Most recently, which is what we'll talk about a lot today, he has developed the Greater Resilience Intervention Teams, or GRIT, and he will lead the new National Institute for Human Resilience. Before we get started, I want to make sure that you all know that we will have some live Q&A after we get through 5 questions with him. So please, anytime, put your questions in our chat and we'll do that afterward. So with no further ado, as I said, I'd like to introduce Dr. Benight. And our first question, can you please tell us what GRIT is and the National Institute?
Sure. Well, GRIT actually came to me about 2 days or so after COVID really hit. And I was thinking about the new institute, which had been approved about 3 days before that. And the institute actually is designed to be a national resource, definitely local and regional resource, to really focus on human resilience and the capacity of human beings to adapt to extreme experiences. And I've done disaster-related research and clinical work for almost 30 years. So it came to me overnight. In the middle of the night, I thought, you know, what we haven't done in disaster response is really train the community. And we've really built up a system through the SAMHSA and FEMA to have some what they call crisis counselors that are stood up in disaster-affected communities. And we're doing that currently across the country for the COVID pandemic. But what that does is it sort of localizes help to only a few people, and we wait for people to come to us primarily. So the GRIT idea, the Greater Resilience Intervention Teams, is really everybody has their own social network. And what I thought would be useful is let's train up people, anybody we can find in the community that wants to be a positive resilience factor in their community, and train them up in a very specific set of skills that can help people to reach out to their family members, to their colleagues, their friends, and so forth, and reach out to them. You know, we were doing this when we were all socially isolated, so we were doing that obviously virtually with appropriate distancing, and now we still have to kind of do that. I think we're allowed to go out and do things, but the idea is to reach out and follow a set of guidelines and skills that you can really reach out to your friends and colleagues and so forth to promote their strength, promote their resilience. And then let's say somebody is struggling, we have a whole set of resources in the GRIT program to give to people to help them to be more resilient, such as online programs like myresiliencehelp.com, which is a free interactive website to help somebody manage the COVID experience. We also have, for El Paso County, we have this thing called Silver Cloud, which is focusing on sleep, resilience, and stress, and a set of other apps and so forth that are available to people that really help them be able to cope with what's going on.
I have a couple follow-up questions I'm going to sneak in outside of our 5 questions, because there is a lot here. All of us are living through this now. What makes this a disaster alongside the other work that you have done? And what does resilience look like? Some days I don't know that I have any resilience, but I wonder, as you do this work, what does resilience look like?
Sure. Well, the answer to the first question is, so this is a disaster for multiple reasons. Obviously, the number of people who've died and the impact on the community more broadly creates a coping challenge that is beyond what's normal for people. So disasters are often sudden and rapid loss of resources that people experience. When you think of a disaster, we often think of a tornado or the wildfires in Colorado or hurricanes. But there are also other kinds of disasters, like technological disasters, such as the 3 Mile Island nuclear power plant meltdown. And this is kind of similar to that, in that when you have a sort of environmental disaster, what's hard is that it's not really clear where the threat is. So if you're living near the 3 Mile Island nuclear plant, you knew that if you were closer to it, it was worse. But still, it was this amorphous radioactivity that you can't see, you can't taste, and so forth. This pandemic is similar to that, in that the threat is very hard to pin down. You don't know if you're getting exposed. You don't know where it is. And so that creates this ongoing sense of threat that people are experiencing. And it creates a lot of anxiety in people, a lot of unknowing how to manage things, what to do next. We're getting mixed messages at times, so that makes it more difficult. So I think that, combined with the economic impact, creates a disaster. And what's unique in this case is that it's affecting everyone. And that creates even more turmoil because it's such a large-scale event. The second question you asked is relative to what's resilience. I did some research on the Oklahoma City bombing, and one of the things that struck me is we interviewed people who were next to the federal building who also were obviously deeply traumatized. And there was something that was very interesting to me, is that people who went through that event and went home and were, some of them went to the hospital and came back. Several of them I interviewed actually were back in the office within 3 days, 4 days. And the capacity to absorb that experience and then be able to put together enough to go back to work and be able to respond to that. And then probably over time managing a lot of emotional reactions that they had to sort of deal with, but then didn't allow that in some ways to derail their effective coping. So resilience is really, I think, the capacity over time to regain a sense of agency is what we like to call it. So the ability to put another foot forward, to be able to see what the next step should be and collect yourself to move in that direction. That doesn't mean that having distress and struggling and even falling down, if you will, that can be a part of resilience, but the key is that you get back up. And that bouncing back process is what resilience really is.
I know you're going to tell us a little more about how grit plays into that, but that is such an important, the trainings that you're doing and that the community happening in the community is so important for that bouncing back that some of us feel so paralyzed. So maybe for our second question, can you talk a little bit about how alumni and other community members can get involved with grit and wellness in the community? And tell us a little more about the growth of the grit program.
Absolutely. So I'm very excited to actually talk to alumni today because I've been teaching at UCCS for almost 30 years. So there are probably maybe some people on the call who I've actually taught, and that's exciting to be able to talk to people again who maybe know me and the work we do. But as far as getting involved, I think the key is, if you want to be a powerful force for your community, it's a very simple thing to do. You go to the GRIT website, which is grit.uccs.edu, and there's a sign up little section there where you sign up for the GRIT training. The GRIT training is completely free, and it's a 5-hour training. It's all automized now, so you can go in and click on the videos that take you through the training. And the training is very specific and teaches you a lot about the pandemic, about disaster stress, about how the pandemic is different from typical disasters. It teaches you about specifics that we try to promote in a disaster environment, like hope, efficacy, connectivity, and so forth, safety. And so those things are all interwoven with the training. And you also learn all about these other resources that could be very useful for you even, or your family, and so forth. So it's a very concrete, specific training that you can do in 5 hours. It takes a total of 5 hours. You don't have to do it all in one sitting. You can do it segmented out. And then you get a certificate at the end. And the thing that's amazing is that when we started this in 3 weeks after COVID hit, basically, so we launched it in April, like 11th, I think. And we are now at 702 people who've signed up, and then we're in 34 states and 3 countries. We're in the US, UK, and Australia. And now we have a connection in Harvard that's, I think, going to help us get into India. So we're really reaching the English-speaking world, if you will, now. And I think, I hope to expand this with people sort of reaching out and sharing it with other people to the point where we're in the thousands instead of the hundreds. But pretty excited, and I'm hoping some alumni see this as a way to help their own community and be stronger.
I hope so too. I have a follow-up question to that one. What is some of the feedback you get from participants who go through the training? What do they tell you or tell the program after they're done?
Yeah, that's been really great, actually, because, you know, when you put together something like this, and we built it off of a lot of research, a lot of literature, we run peer support programs for first responders all the time. So we were not new to this kind of idea, but you never know how it's going to play. And we did it relatively quickly because we wanted to get it out. But what we find is that almost without exception, people really like it. They like what it teaches them. They feel like it gives them great information. But most importantly, they say it individually is helping them cope better too. So it's not only helping them to reach out to others, which we know when you're pro-social and you're reaching out to people, that's actually a great coping strategy for us because it takes our mind off of ourselves and puts it on other people. So that's all good. But it also just, I think, gives you tools to help yourself. And so I think that's been a very useful and important component. And then secondarily, people have described being able to reach out to someone they really care about and feeling like it's making a difference in their lives. So that's a wonderful thing.
I think so many of us are have struggled with what to say or what to do. And the program provides some tools for that.
Exactly. Yep.
Okay. Are you ready for question number 3?
Sure.
Who is the grit training tailored toward? Do you need to have a particular expertise or some background? Tell us who it's tailored toward and who can participate.
Yeah, that's a great question. Because often people are thinking, oh, is this, you know, I'm not a mental health provider. I don't have any mental health training or anything like that. And you do not need any of that kind of background for this. It's really designed for the general public, anybody and everybody, if you will, because really the way we're going to have the biggest impact is to get as many people from the community who are interested in this to sign up. And so we have such a broad range. We do have physicians, we have hairdressers, we have, I think there's a data analyst, a NASA data analyst, we've got nurses, we have Air Force people, a lot of military people have signed up, nurses have signed up. So we have a huge range, which is exactly what we were hoping for. Because if you think about the dispersion into the community, you really have all of these types of folks who are out there in their own networks. And what we want is as many of those people to do it as possible. So, you know, if you're sitting back in your house listening to this and you're thinking, you know, one of the things that I haven't been able to do is figure out how to talk to my friends or how to reach out to my colleagues at work, because I'm noticing one of the things we're doing a lot right now is helping with burnout and secondary trauma in a lot of first responder organizations, public health, hospital workers, so forth, and firefighters, police, and so forth. And, you know, what we're seeing is that there's a lot of people who are getting pretty tired and they're getting a little burned out. And this kind of training can give them a new sort of lease on life because it helps you to think about how to help yourself and others more directly.
So to summarize, anyone and everyone, you don't need an expertise, you don't need letters after your name. We all have a role to play.
Absolutely. And we say in the training that this is similar to being a coach. It's a resilience coach. And so when an athlete hurts him or herself and it's a little bit of a sprained ankle, the coach can manage that, can talk to the athlete and so forth. If the athlete's laying on the ground with a broken ankle, what does the coach do? He or she calls in a physician or an orthopedics or somebody like that. So there are times when a professional is needed. These trainings are really focused on just being a coach. You're not a mental health person at the end of this at all.
I'm going to switch gears a little bit and talk about your own experience during this time. Have you picked up a new or old hobby? I know you're very busy doing this work, but is there a particular pastime or hobby that you've picked up or tried out?
I wouldn't say new hobby. I guess the newest thing is I sit at my dining room table and work all day instead of drive around to appointments. So that's new. But I actually do a lot of self-care by getting out into nature. And I'm lucky to live up near the foothills here. So I spend a lot of time either hiking or running on the trails near here. And I think that's been a fabulous sort of byproduct of the pandemic, in that it gives me a little more flexibility because I'm not over at a different location. I can just kind of take a few minutes and get outside and then come back and so forth. So I think the new hobby is integrating more exercise and time out into nature during the day instead of just on a weekend or something.
I have a follow-up question to that. Is that picking up a hobby or being out in nature, is that a resilience tool?
Yes, absolutely. I mean, there's actually some good evidence that nature can be healing for people, especially around trauma. There's some data out on that more recently. And I think at this time when we're looking for things that are grounding for us, I mean, when our normal routines are so disrupted, I think now we're in a weird phase of, people are calling it the new normal, yet the new normal is changing every day. So it becomes very difficult to have anchors. And I think finding that opportunity to be outside or to have something like nature that is somewhat static. I mean, it's changing every day too, but it has that feeling for a lot of people of beauty and grounding that can be just nice to see something, especially during the summer. I love winter too, but just beautiful stuff that helps me breathe that in versus sometimes we get hooked up on social media and CNN and Fox News and all these things. And it's so much negativity that I tell people right now, I think people should take a huge break from that kind of information overload, because it just drives down mood, makes people feel threatened and anxious. And there's data out around that right now. They had a certain name for it, like
Doom.
What is it? Doom's what?
Doom scrolling.
Yeah. And that's just like, no, that's not good for you, So get your information maybe twice a day. That's all you need. And don't spend all day long doing that. It's just not healthy.
Well, I have our fifth question, and then we'll go to some questions that are in the chat. Both personally and professionally, I've talked and in my groups talked about silver linings to the pandemic and disaster, really, as you call it, as we know it. What would you say some of your personal or professional silver linings are now?
Well, in a very weird way, for the National Institute for Human Resilience to launch like 3 days before we really took off on the COVID response, that's been a silver lining for us because it's allowed us to become a resource for the community in ways that we didn't really anticipate so quickly. So I'm working with the state public health department, the local public health department, United Way, Pikes Peak United Way, all kinds of other organizations in the community, and the crisis response teams from the city and county. And so it allows us to serve a role that I was hoping the Institute would serve, but not immediately, not easily, but as quickly as it's happened. So that's been a silver lining. I think another silver lining personally has been that this has just emphasized more to me, which always comes to me at different waves, is the importance of relationships in our lives and how we often get distracted from those with doing our daily kind of busyness and running around and all that, and having more time at home, actually, even though it's been hard sometimes, has been great because there's more time to be with the people whom I love. And shine a light on the importance of that. So that's been a silver lining, I think.
Thank you. We have a lot of questions rolling in, so
Great.
you can stay with us for a few more minutes.
Absolutely.
All right, I'm gonna go after these on my other screen and look forward to your responses. If you had to pick one or two of the most essential skills for us to focus on cultivating right now, what would they be in terms of resilience?
I think probably the self-care skills are probably the most crucial right now. One of the things that I talk about also on the GRIT website for people to know is that there's resources up there for a number of different groupings like first responders and medical providers and others. So there's tabs with information up there. I've also done a series of podcasts, and I'm planning on doing a total of 30 of them. But one of the initial podcasts, I was talking about hope and the importance of generating hope. And hope comes from a sense that the future can be better than it is right now. And I think with the data that we're getting and the way this pandemic is unfolding, that becomes difficult for us. And so I think it's critical that we have sort of a grounding self-care strategy that makes us feel like things are okay, I'm going to be okay, the family's going to be okay, and knowing what we can do to feel like we have some control. And I think those things are going to be things that we know help keep us safe right now, which are going to be, social distancing, wearing masks, things like that, and being aware of not kind of loosey-goosey going out and potentially getting exposed. And at this point, I know that's hard for people because we're ready to be back to normal. And so I think having a plan of self-care that can create that sense of calmness and sort of steadiness at this stage of things can, I think, be really, really helpful.
Thank you. You touched on this, but we did have someone ask this question, and I want to give you an opportunity to elaborate if you have anything to say about it. And that is, how much does ecological support play a role in a person's grit or resiliency?
Very much so. So there's a whole theory called conservation of resources theory that's out there that's been used in disaster work for many, many years by Stephen Hobfall. And he really talks about the power of the environment and social support and ecological support. I assume ecological support is a term in this case for social support. But even environmental support more broadly is going to be vital. So it's not just that we all have to hunker down and do things for ourselves. There are a lot of people in our community who are losing jobs, potentially losing homes, and things like that. And so we need to shore up the environmental support and resources in addition to the individual motivational resources that we all have to make it through effectively. So I think it's really important that we don't think of ourselves as isolated sort of entities in this process. We're one big community. We're one big nation, one big world, and so we need to think collectively as well and promote those resources getting to the people who vitally need them. And that's going to become, I'm guessing, the next, we talk about the pandemic waves. I think this will be the next wave, which will be the economic hardships of a lot of people because of the way the pandemic is unfolding. And that's going to be hard, and we need to think about that carefully to bring resources to those people.
Here's another question that came in that is dear to my heart as a mother. What recommendations can you provide for us to help our children develop resilience in this environment and as a life skill?
Sure. I think kids are in a unique experience with this because of the unpredictable nature of it. And for kids, stability, consistency, normal kind of routines are critically important for them to feel a sense of safety, a sense of calmness in their lives. And so I think we've done a lot of research looking at parents and kids in disasters. We have one from wildfire work that we've been doing out in California. And what we know is that the parents' reaction to the experience, to the pandemic, or the pandemic in this case, is important in terms of driving how the kids are responding. So if the parents feel a sense of sort of stability and direction and routine, the kids will respond accordingly. So I think we need to make sure that we're creating those behaviors in the day-to-day experience that are as sort of stable and consistent as possible. I also think it's relative to the age of the child. So younger kids are going to be much more focused on just that stability and consistency. If they regress, which is typical for kids when they're under extreme stress, if you see a kid, for example, that was potty trained for a year and a half and suddenly they're having accidents, that's an example of that. Sleep disruption is another example of that. Tantrums when they weren't tantruming. So that regressive behaviors are just examples of stress. And so what we want to do is look for ways to reduce that stress and increase consistency for those kids. Older kids will act out in different ways. Of course, we know teenagers will become sort of difficult to even have in the same house at times, but having raised two teenagers myself and so forth. So I think as the kids get older, it's really important to have talks with them. And not talks like, oh my God, how bad is this going to get? But, just allowing the child to express their inner experience. And if they're feeling threatened or if they're feeling upset because they can't see their friends or they wish this were happening and that were happening, I think being a good listener to those children and then providing reassurance that we're going to get through things, it's going to be okay. Let's see what we can do to get around this problem without creating another problem. So I think, communication, consistency, stability, and your own self-care enough so that you can be that stable force is probably the best things to do.
Thank you. Do you have time for one more?
Of course.
One more. And I do want to give a special shout out to Dean Vidler, the new Dean of the College of Letters, Arts, and Sciences, who joined us today. Thank you, Dean Vidler, for your comment. All right, here's our last question. And again, I want to remind those of you who are on the webinar today, this will be available for replay, and please share it. This is part of our effort to share these resources with the community. Here's our last question. When trauma happens in one's life or around the globe, is it ever too late to look to GRIT for the resources or join the program?
Oh, no, absolutely not. I mean, for one thing, having been exposed to a trauma doesn't mean that you're not effectively living with that trauma experience. There's often this statement of, get over things. Did somebody get over things? I don't like that term. I think it's how you adapted to that experience and kind of absorbed it into your life. Sometimes for some people, unfortunately, it becomes what we call the black hole of trauma. It becomes their life revolves around the trauma, and that can be a difficult thing. I think the GRIT program can teach people, again, how to reach out to others and maybe how to help themselves at some level, but also critically in our GRIT training, we actually provide phone numbers for crisis lines, significant mental health support that people can reach out to. So if somebody's had a significant trauma in their past, and this may be bringing that up for them, that's a whole different question. And the GRIT program can help with that in the sense of guiding them to potentially some other resources. I would also recommend that if somebody's struggling with more severe trauma reactions, depression, and even some suicidal thoughts or anything like that, they should reach out to the Colorado Crisis Line. And maybe you guys can provide that. I don't have it off the top of my head, but we can make sure that people have access to that because those phone numbers are available right now, and they could call them instead of kind of going through the GRIT training and then getting the information there, because it is there, but I'd rather people get it more immediately if they need it.
Thank you, Dr. Benight, for the work you're doing at UCCS and in the community and in really the global community. Do you have any last thoughts you'd like to share with us? Sure.
I think I love having the opportunity to speak to people right now because this is an unprecedented experience for us all. And I think we see a lot of struggles in our culture that are happening pretty broadly. And I think we just have to really think about how to come together and how to think about this as we're all in the same soup, and we need to that's why the GRIT program is so important, because I think we need to reach out to each other and create a sense of positiveness and strength about getting through this all, rather than sort of seeing things almost fray at the edges as we're going through it, which it's stressful. There's no doubt about that, but we're going to get through it. And I think we get through it stronger if we're together on it. And I hope everyone on this call can be a positive force in that experience.
Thank you. And we have posted the link to the GRIT website and resources in the chat, so please look for that. And thank you for being here with alumni and friends today. Thank you for the work you do, and we'll keep an eye on your work.
Well, my pleasure, and thank you for inviting me. I appreciate it very much.
Thank you, Dr. Benight.
Bye-bye.